What position should I sleep in? It's one of the most common questions I get from my patients. I hear it almost every single day. Hi, I'm Dr. Ian Puntney from Lexington KY Chiropractic, and today we're talking best or most ideal sleeping positions. So my number one rule for my patients is to not overthink this. It should not be that complicated, but people tend to spend a lot of money on pillows. Maybe they're buying mattress toppers or getting top of the line mattresses. And at the end of the day, they're still dealing with pain every morning when they wake up. So the general rule I always tell people is don't overthink it. Just keep your spine neutral while you're lying down. So all that means is if we look at my spine from top to bottom with me seated here, my spine is in a neutral position right now. Now, if I turn my head like this and rotate, that is not neutral. That's rotated and tilted. So again, neutral just means straight from top to bottom. One thing I talk a lot about with my patients is your nose in line with your sternum. So just the middle of your chest bone here, your rib cage, is it in line there? If it's tilted this way, it's not in line. So we want to try to stay neutral here, which is important whether you're sleeping on your side or your back. The other thing is, if we look at a different plane here, are you flexing your head and neck and shoulders due to a pillow that's too big? Maybe you're sleeping on your stomach and you're extended and rotated. Those positions aren't going to be best, especially if you're waking up with pain. That could be why. So I tell people typically to try to aim for sleeping on their sides or their back to avoid sleeping on their stomach. I just find that some people can pull it off, but most of the time, over time, if you're not 20 years old, you're a little bit older, you're going to wake up stiff. A lot of times you're sleeping with your hands up here, your head's tilted and rotated. And that's just going to stiffen you up over time, especially if you're sleeping hard and you're not moving around throughout the night. So I would try to avoid that position. I would sleep on my side or sleep on my back. So I'm going to go through, I've got a couple pillows here. These are my pillows. I brought them from home. And I just want to show you good positions versus bad, and then my typical setup or what I recommend for my patients. So you'll see I have two pillows stacked here. So I'm going to go over side sleeping first, and what a lot of people do and what to avoid. So a lot of people will have a couple pillows, and you can see as I get here, my nose, again, it's not in line with my chest. So my head is tilted up and it's out of a neutral position. This isn't great. So if I sleep for 8 hours, which never happens because I have kids, but if I were to sleep hard one night and my head's tilted like this, it's going to jam these joints up. I'm probably going to have some stiffness in the morning. Versus if I just have one pillow, you can see that my head now, my nose is pretty much dead center in my chest. So it's not tilted up, it's not tilted down. These pillows are not special pillows, they're just regular pillows, but I just have them in a position that keeps this neutral. The next thing I tell people to do is if you're going to sleep on your side, it is best to typically have something between your knees and have the pillow run parallel with your lower leg bones. So in other words, just your knee and your ankle are both supported. That way this is neutral here. That takes some strain off your low back and pelvis. And again, we don't want to have one leg like way over. We just want to be neutral. Just again, don't overthink it. Stay neutral. And then a lot of times I'll hug a pillow just kind of like this to keep my shoulder from getting up here, or like what I'm doing right now. I have a pillow right here that I'm hugging. If you're on your back, the same thing applies. Too many people sit in bed, maybe they're watching TV or reading with two big fluffy pillows, and as they lay down, their head's cranked like this. And then they wake up and, my neck's super stiff. Well, of course it is. You slept in that position all night. So what I tell people again is, yes, you can go buy the cervical pillows, the rolls, the supportive pillows, or you can just find a pillow that's soft enough to where you can form it to where you need it. And again, like as I lay here, I'm pretty neutral. Again, my head may be slightly elevated, but not much. You don't need to overthink this. A lot of people too will put pillows underneath the knees, which is good. This table's not the best because it's not a bed, but a little bend in the knees typically is going to decrease some of the pressure in your low back. So if you're somebody that's a back sleeper and you don't have head or neck pain when you wake up, but your low back feels tight, you may want to put a couple pillows underneath your knees just to bend your knees a little bit, and that'll take some pressure off your low back. The other thing you can do is if you're having a lot of neck stiffness and pain throughout the day, and it's just uncomfortable to lay at night, you can roll up a towel or a hand towel. I typically would want it slightly bigger than this, but what you can do is just get rid of your pillows altogether, lay flat on your back, and put this is going to go right in the middle of your neck. So you're creating your own cervical pillow or your own roll. So again, no pillow, but I'm just going to put this right there, and that's going to push up on my neck but allow my head to come back into this neutral position, and it just opens up those joints a little bit, and typically can decrease your neck pain as well if you're having pain throughout the night, or you have one of those episodes where you wake up and it hurts and you just can't get back to sleep because of the pain. You can't get comfortable. That's what I would do. So again, sleeping, don't overthink it. Keep your spine in a neutral position. Avoid sleeping on your stomach. Avoid cranking your body in different positions and then sleeping for long hours. The more neutral you are, the better off you'll be. Keep it simple, and I hope that helps. Talk to you later. Bye.